going to, there we go. There it is. Okay, welcome everybody. Here we are yet again at our Living Chassidus Life Skills Series. Here we help our name is Living Chassidus, and our purpose is to not just learn the Chassidus, but to also live with it. And that is one of the reasons why our Life Skills Series is such a crucial part of our organization. We are helping women really prepare for the stages in life that they are truly living with from a wholesome perspective. And we are so lucky to have today, we have Chloe Lubell. She is a certified nurse midwife and mother with nearly 7 years of experience guiding parents through pregnancy, birth, and postpartum period. She also comes highly, highly acclaimed by one of my favorite people in the whole wide world, my midwife, Kristen. So we all know that we're just so excited, and we're so lucky to have you, especially since last week we all gave the special blessing that the mother should have an easy labor because we missed her last week for a birth. And I have to say, many people responded that they were so happy to find a midwife that's so dedicated that she was even willing to cancel a speaking engagement with her mother, one of the moms giving birth. So I also want to say that tonight's program is for Refuah Shlema for Shoshana Tova Bas Leah. May we hear good news, and Refuah Shlema for everyone else who needs. And with that, I will pass on the baton to Chloe. Thank you so much.
Thank you so much for having me, and thank you so much for being patient with me last week when I couldn't show up after all. I said this to Michal, but the woman who gave birth had a beautifully fast and smooth labor, and I can only think it's from all of your good thoughts. I also had my baby with Kristen and Barry, and I am, oh, did I lose you somehow? No, okay. I don't know what happened. Excuse me, hang on just a second. How do I come? I swear I'm better at technology than this. There you are, you're back. Okay, so I had my baby with Kristen and Barry. I'm so honored that Kristen would speak well of me. I am devastated that they are leaving practice, but really happy for them to move on, and happy to be able to help out for all of the folks who, similar to myself, feel a little left behind when they departed. I am a certified nurse midwife. I do work with people throughout their whole lifespan. I work with young women who are just going through their first cycles, who are just learning what it is to have a menstrual cycle. I work with people who are trying to become pregnant, people who are pregnant, giving birth, all the way through to the end of life, and end of hormonal life changes as well. I'm here to talk about mostly whatever you want me to talk about, but I'll start by giving a quick little brief overview of what I talk to people about when they come to me and say, you know, I'm about to start trying, what do you recommend that I do? And I think of this time becoming pregnant mainly as a way to reconnect with yourself and really nourish yourself and your body and your mind-body connection, your spirituality, and be able to take care of yourself in a way that you maybe have neglected a little bit recently, because now you have an excuse to do that for the sake of someone new who might be coming into the world. And I think of it as, this is maybe a little bit of a silly analogy, but I think of your body as your garden, and you can't plant seeds in a garden that doesn't have well-nourished soil, or you can, and many plants will grow, but it takes if you have the time and the energy and the emotional space to put the work into it, really beautiful things can happen. So I recommend treating yourself like you're already pregnant. That's the first rule. That means eating really good food, eating vegetables and fruits of all colors of the rainbow throughout the day. That means trying to get protein every time you eat. And this is a tricky one, I recommend trying to eat trying to eat every 3 hours. Even if it's not a huge meal, just a little something every 3 hours is going to regulate your blood sugar. If you were in a cave being chased by a bear, your stress hormone, your cortisol, would shoot up, and your body would dump sugar into the bloodstream to give you energy to run away from a bear. Our bodies are amazing and can really protect us well. But this doesn't help if you're in your house. Maybe you're cleaning the kitchen, maybe you're reading a book and not doing something that needs to be running away from a bear, but it's just been a little bit past 3 hours. Your body is going to use that same trick in order to get you the blood sugar that it needs. So you eat a little bit, 3 hours goes by, 1, 2, 3, and then it drops off. And when your body feels that drop off of blood sugar, it's triggering that cortisol surge, that stress hormone, to dump more sugar into your bloodstream so that you have the energy to keep going. Again, this is a fantastic technique that our body has to keep us doing well, but it also means that you are having these little surges of stress throughout the whole day. And everybody knows that 3 p.m. slump where you're exhausted after lunch and you not really feeling up for the rest of the day, but it actually happens the whole day long. So my recommendation is to start eating within 30 minutes of waking up if you can, or as soon as you can on waking up. And then eat, and maybe you have to set an alarm on your clock if you need to remind yourself to eat every 3 hours after that until bed. And that means, what that does is that it really allows your body to start to regulate the hormones. Because when you are in a low grade chronic stress situation of just being hungry all the time, your body has to focus on the stress and can't focus on your reproductive health. Because reproductive health is not necessary for life, it's the very first thing to go. So really giving your body everything it needs in order to function optimally is really valuable. And I know I'm not supposed to be answering questions as they come up, but I do see someone who asks what kind of food. Delicious food. I fully believe in the healing benefits of food that tastes good, but it's really valuable if you can get a little bit of protein each time. Protein can be meat, it can be dairy, it can be eggs, it can be nuts, any of those things that work for you in your life and in that moment, and that taste good to you. And it does not have to be a lot. A small handful of almonds is good. And it does not, because you're not eating lots of food, you're just eating this, perhaps you could consider the same amount of food, just more often throughout the day to regulate the blood sugar throughout the day so that there's less peak and trough there. I don't find in my clients who try doing this, I don't find that there's a lot of weight gain, especially because at the same time, people are starting, maybe for the first time, to pay attention to the food that they're eating a little bit more and the quality of the food. Additionally, I love for everybody to get exercise. That can be as much or as little as works for you and your body, but the minimum is 30 minutes of your heart faster than normal 3 times a week, which many people can do just by, power walking to the grocery store or to go see a friend. Just getting an extra block of walking will get your heart rate faster than normal, get you a little bit schwitzy, and then that's enough to get your blood pumping and your also to work towards hormone regulation. These are the first 2 steps: food, exercise. I'm sure that's not surprising. Then there's the other things that you take into your body, like supplements and vitamins. I strongly recommend, not surprisingly, again, a prenatal vitamin. You can take whatever prenatal vitamin is cheap and easy to find, but I will recommend that you take a prenatal vitamin that has folate rather than folic acid. Folate is the food-based version. Folic acid is the synthetic. And while we take in many synthetic vitamins all the time, and I don't think in and of itself synthetic is bad, in this situation, there is actually a gene mutation, the MTHFR mutation, that many more people have this mutation than realize that they do. It's very expensive to do the testing for it. So I don't necessarily even recommend doing the testing, but just treating yourself as if you have it. And what this mutation does, among other things, is it makes it so that you just cannot use folic acid. You have to use folate. So I tell everybody it's easier for your body to absorb whether you have this mutation or not, but folate is a healthier version of this vitamin. And this supplement in particular, this nutrient, folate, is really valuable for babies' neural tube development. We all know that everybody has to take folic acid during pregnancy. It's in order to prevent things like spina bifida, which is an open neural tube defect. So a healthy food-based vitamin. After this visit or this talk, I can send a list of my recommended brands if you'd like. I also recommend that your prenatal vitamin, either in your prenatal vitamin or separately, you take something with omegas. There's many omegas can be found in fish oil, if that works into your life. If you would rather not have fish oil, there's also vegetarian and vegan options that for different omegas. So that's really healthy. That's really healthy for general, it's good for your hair and your skin and your nails and your mood swings overall. It really helps to regulate mood, and it's excellent for baby's brain development. So that's something to continue through the pregnancy. I think making sure that you have some kind of either probiotic or probiotic food that you're eating can also really help to just take the load off for your body. When you take probiotics, these are honestly, they're capsules full of bacteria that will help to digest your food for you, make it easier on you. It's good for all sorts of things, including your body's flora. It's great for preventing if you have lots of yeast infections or other kinds of imbalances. It can help with that as well. But these are just general things for overall health and also specifically for pregnancy health. If you are over the age of 35, and you're hoping to become pregnant, an excellent supplement is called CoQ10. That's CoQ-10. And CoQ10 is ubiquinol. The active ingredient is ubiquinol, and ubiquinol is what feeds the mitochondria. The mitochondria are the things inside of each of your individual cells that powers the cell. And what this does is it gives each of your cells more energy, allows them to function better. And specifically for pregnancy and prenatal, or rather fertility, it improves egg quality. So your eggs can take up to 3 months for starting one of these interventions to improve the egg, because the beauty of what happens inside of your body is that the eggs that you have from the moment of birth are they're sort of, I think of them as in the freezer until you get close to using them. Then you take them out of the freezer, you sit them on the countertop to thaw, maybe to brine a little bit. And then once they're ready, then you use them for trying to become pregnant. So it's about 3 months from when they come out of hibernation and get percolated in all of the wonderful things that you're doing for your body, your good diet, your good exercise, your nutrients that you're taking in. And then after that, then they're used in a cycle for ovulation. I see someone asked, is it possible to get everything you need from food? Yes. Honestly, if you eat a very well-balanced diet with healthy foods, about a pound of fruits and vegetables throughout the day of every color of the rainbow, good protein of various sources, then yeah, probably you can get everything you need. If you would rather not take a vitamin, you can also, if you're interested in herbal medicine, there's a tea that I love and I think is essentially as good as a prenatal vitamin. It's a combination of red raspberry leaf, red clover, and nettle. And because I'm a baby, I always add peppermint because I don't like how it tastes, but that's up to you if you'd like to add that. The combination of those herbs includes a number of wonderful things. The red raspberry leaf has an alkaloid called fragrine, and fragrine is a chemical that strengthens smooth muscle. Smooth muscle is a couple different kinds of muscles in your body, but for our purposes, also the uterus. And it strengthens the uterus and it makes it so that the fibers are better coordinated. So that during labor, there's actually good research to show that if you drink red raspberry leaf throughout your pregnancy, in labor, you're less likely to have interventions, you're less likely to have cesarean birth, and you are going to push for less time. So that's all great per my account. And what I recommend doing with these herbs together. Oh, and so that's in the red raspberry leaf. The red clover is really good for your hormones, for your menstrual cycle. Take the red clover until you become pregnant and then take that out of rotation, but continue the red raspberry leaf and the nettle. And nettle is just chock full of nutrients, magnesium, manganese, calcium, all of these excellent things to replace what you might not be getting in your diet. And you do need, so pre-pregnancy for fertility, you don't really need all that much more than you're taking in with a good healthy diet. But if you once you become pregnant, you might need just a smidge more, which is why it's helpful to take a prenatal vitamin. So you don't have to worry if there's, especially in the beginning of pregnancy when you're feeling really nauseous and all you want to eat is saltines, you don't have to worry that you're losing those nutrients out of the calcium out of your bones, the magnesium out of your muscles in order to feed the baby. Because no matter what, unless you are in true starvation mode, baby's going to get everything that they need. It's just that they're taking it from your body, from your stores, rather than from the nutrients you're taking in. So that's when I recommend a prenatal vitamin. I'm seeing many comments now. I have some suggestions for For protein-rich snacks, I can send the handout over. Um, I don't have a full diet, like a sample menu, but I don't want you to change your diet entirely. I just want you to make sure that it has the components that you need, which are in this situation in particular is protein. So if you normally at lunch would have a bowl of plain pasta, add a little protein, whether that's a meat, whether that's a dairy, whatever it is in that moment. Um, Add that in, and then it will actually power you for just a little bit longer and give your body the energy it needs just a little bit longer. But you don't have to change your entire diet. You don't have to eat very particularly. I truly believe that the best way to eat is a way that feels fulfilling and delicious to you. So a question about red raspberry leaf, if it's safe to take throughout all of pregnancy, and yes and no. It's definitely safe to take before you become pregnant. For my clients who have really hard, crampy, uncomfortable, heavy periods, I recommend it to everyone, all of them, because it can be so good for the uterus. If you're taking it in early pregnancy, so for someone who's been taking it all along, they might just continue taking it into pregnancy and they probably won't see a difference. If you're going to start taking it during pregnancy, maybe in the second trimester, I recommend starting just with 1 cup. Wait, see how it feels. For some people, their bodies are really reactive, and they will start having a bunch of contractions. Okay, then you stop and you wait, and you don't drink it again until 36, 37 weeks at the earliest. For other folks, they can drink it extensively and have no issue. When you are pregnant, again, it's about your body and your life, but the research that exists suggests the research that exists was only done on people drinking red raspberry leaf starting at 36 weeks. I think it's safe and healthy to start sooner, and probably not a bad idea. But you don't, we see great effects even just starting at 36 weeks. My recipe is to take about an ounce of dried herb. So that's usually about a decent sized handful of dried herb. You put that into a jar, a quart-sized jar. You pour boiling water into the jar, fill it up, put a lid on, and you stick that on the countertop for 4 hours or overnight. So you really let it steep. You're making what's essentially a medicinal dose of that herb. And then you can drink 1 to 3 cups a day. And if you want to, at the beginning of the week, you can make like a huge pot and then have it in the fridge throughout the week. Okay, I'm going to hold off on this next question until the end so that I can talk a little bit more about, well, actually, before I get into more specifics, I wonder if there's, Michael, if you wanted to, if there's any particular direction that I should go at this point that would be helpful to the group. Any ideas?
I would say, can you hear me?
Mm-hmm.
Okay, great. I would say we do have a mix here of people. Some people have had children and many of them have not at all. So I guess anything that they can do, let's say, I mean, for many people in our community, it's like, okay, once we get engaged, once we get married, that's like when we start really turning. But is there anything we can do or we can be aware of other than, I mean, obviously the things you said already have been amazing.
A really helpful thing is to have a good sense of what your cycle does. Everybody's cycle is different and nobody's body has read the textbook. So learning your cycle and what your body does is going to be the best way to figure out how best to become pregnant, because you might find that when you really tap in and start to pay attention and track, you might notice that your cycle is very short or very long. The average cycle is 28 days. And this is from the so when we count, at least in the medical community, when we count cycles, we start with the first day of the period. And then we expect, again, if your body has read the textbook, that you're going to ovulate 14 days later. I don't have a particular app that I recommend. I'll send you guys so many things. I'll also send a paper chart that I like to use, and the paper chart is extensive, and you do not have to track all of this information unless you have a reason to think that you need extra help becoming pregnant. I have no reason to think that any of you do. But I'll send you my paper app, my paper chart. Another app that I like is Kindara, and the Clue app is good. And there's an app called Taking Charge of Your Fertility, which is associated with a book of the same name that is a fantastic book if you're interested, by Toni Wexler, I believe is her name. In any case, it's, even if you're just writing down in your calendar, your paper calendar on the fridge, you just make a little star on the first day of your period, you'll start to get a sense of how long your cycle is and what's going on with that. You'll notice in your body the changes that happen throughout the cycle and the changes that happen as you become closer to ovulation. To be very frank about it, you'll notice that your cervical fluid will change, and you'll notice your discharge change from, of course, your menstrual blood to begin with. After that goes away, most people have like a thick, white, tacky discharge, and that changes to become a little bit more white, a little more copious, slippery, and then it turns to this clear egg white discharge. And when it looks like raw egg whites, and you can hold it between your fingers and do this, and it'll create a spindle, that is considered fertile fluid. It's nice if you have a couple days of that, but if you don't, it doesn't matter. It doesn't mean anything particular. It just means that's what your body does. That's a really good sign that you're fertile, either the days that you're having it or the day after it ends. Those are probably the days that you're ovulating. And if you are I'm seeing a lot of questions that are a little more specific right now. And those are things that I can go into as with individual people. I can talk about this forever. So I'll start by saying, ideally you want your cycle to be 28 days or so. The time that a short cycle is a problem is when there are not 11 days between ovulation and the next period. So the length of the overall cycle doesn't matter as much as knowing when you ovulate and when the next period starts. So if you can tell when you ovulate, you can count each of those days. If you don't have 11 days, what happens is that you might have a fertilized egg. Success, sperm and egg meet. They make a fertilized egg. The egg takes a few days to come down from where the fertilization happens, which is actually out in the ovarian tubes, closer to the ovaries, not inside of the uterus. And then it slowly comes down the tubes and into the uterus. And right as it's about to implant into the wall of the uterus, if you don't have a full 11 days, that's when your body starts cramping and you pass that egg out and you have a period instead of a pregnancy. So what you can do about that, there's a lot of things, but you can, the main thing that you can do is, uh, one good thing to do is to take an herb called Vitex. Vitex is also called chase tree berry. Are you having trouble hearing me? Okay. Um, uh, Vitex chase tree berry is an herb that can be taken as a tincture or as a supplement, like in a capsule. And it's a beautiful herb. Again, somebody's out there watching out for us, because what this herb does is it opens up the receptors in your body to take excess estrogen out of your bloodstream and allow your natural hormone regulation to come back into balance. And it allows your cycles to lengthen a little bit and regulate, which is good. It's been used for millennia to help people get pregnant in all sorts of different cultures. Let's see. Vitex, V as in Victor, I, T as in Tom, E, X. And another really good thing to do for everyone all the time, but especially if you're trying to get pregnant, and especially if you don't have a regular routine cycle, or if you have a particularly heavy or crampy cycle, is to get acupuncture. Acupuncture is amazing. It's some kind of magic. I don't understand how it works, but I do see incredible results. If you can get it once a week, that's fantastic. If not, once a month, twice a month is excellent. And I'm getting distracted by all of the questions that are coming in. Another really good thing you can do is look into what is called abdominal massage. It's a specific modality that comes from Central America. It's also called Maya abdominal massage, and it allows you to improve your uterine position. Who even knew that that could happen? And improve the blood flow to your uterus, the blood flow to your ovaries, to really optimize their ability to function well. So some main reasons why you might want to do that is if you have an irregular cycle, if you have a lot of clots or really, really crampy periods. These are things that, even though we all learn that your cycle is just uncomfortable and you should expect that to be the case, it's actually not really true. What you should expect is to have a pretty painless, maybe some cramps, maybe some discomfort, not very heavy, no clots in the blood. So you can sort of aim towards that. Sometimes there's other more major stuff going on that can cause these problems, and that's when it makes sense to get checked out by a doctor. Okay. I'm not sure how much time we have and then when it makes sense for me to go fully into answering the questions.
Maybe we could, we have until 9, so we have time. But maybe I could ask you more of a general, and then we could jump into the questions. So another general aspect of it is that within our community, we tend to not be very vocal. There's a point to that. There's a reason why, but we don't really speak about our early pregnancy stages, not with our friends, not with anybody really. And I have noticed that there are some people that haven't yet even known where to turn to reach out for a midwife or reach out for, So what would you tell someone who's in early pregnancy, who before she calls you, what should she be thinking about? What should she be doing during that stage?
Being really gentle with yourself. Early pregnancy is like being, for many people, not for everyone. There are always a few people who have no symptoms and no problems, which is fantastic. But for most people, early pregnancy is hard. It's like getting hit by a truck. The exhaustion is more exhaustion than you ever felt in your life. The nausea can be really intense. So just giving yourself the space to recognize that you're creating a human, which is an immense amount of work. You don't see the work, but you're doing it. Taking naps, if you can take naps. Eating every 2 hours is going to be the best way to prevent nausea. It doesn't matter what it is. If the only thing you want to eat is cheese puffs, eat that. Whatever you can stomach. And actually, for a lot of people, it's things that are a little bit acidic. So lemon candies generally work well. Ginger is amazing for nausea. So you can actually get these little candied gingers that you can keep in your purse if you don't want people to know that you're nauseous. You can just sort of pop them throughout the day. I also find that things that are a little bit pickled. So when I was pregnant, I had intense cravings for kimchi, which is, Korean pickled food. I don't have no idea why. It's not something I eat a lot of. But anything that is a little bit sour, a little bit vinegary, people really get some relief from. But when you are thinking about finding a provider, I recommend thinking about who can provide for you the kind of birth that you want. And you may not know what that is yet. And that takes its own, we can have a whole nother session of talking about different kinds of birth. But if you know for sure that you want, for example, an unmedicated birth, then you need to go to a provider who can help you do that, who has the experience. Similarly, if you know for sure that you want an epidural with no interest in having any sensation of the birth, you got to go to a provider who can offer you that as well. So in that situation, home birth might not be the right choice, but there are amazing providers in home, hospital, birth center here in the city. And I kind of got distracted because you were asking what someone should be thinking about before they even call the provider, but mostly it's just really taking it easy with yourself. And also the basic things. So avoid foods that could make you sick. Avoid alcohol. Alcohol very likely is safe in certain amounts throughout the pregnancy. We don't have good research to say one way or the other. I generally think if you can do so in a way that works for you, to avoid alcohol during the first trimester, and then bring in little bits here and there afterwards if you would like. And of course, a sip of wine is not going to harm your baby. Also, you're generally going to want to avoid bigger fishes. So bigger fishes have high levels of mercury because they eat all the littler fishes, each of which has a small amount of mercury, and they collect it all. So if you are eating fish, try to stick with smaller fishes.
A great question, which has to do with what you're saying now, is when does somebody contact their provider?
I have people emailing me. I think they're probably still holding the pregnancy test in their hand as they are emailing me. And then I also have people who reach out much later after the first trimester is over. It's about when you feel like you need the support. Some providers will not see you for the first visit until 8 or 12 weeks of pregnancy. And when we count weeks, we count from the first day of the last period. So when we say 8 weeks, that's actually only 6 weeks of pregnancy, because it's 8 weeks starting from the last period. But for whatever reason, that's the measurement we use. So you can, find the provider that you want. And if you are ready to work with them, give them a call and schedule an appointment for whenever they're willing to start seeing you.
Any other tips for nausea and exhaustion? Anything else you can say? Because I know a lot of people, it's a big deal.
Yeah. Alcohol swabs are amazing not for everyone, but for some people. And all of these things don't work for everyone, but they're worth trying. If you have alcohol swabs, or even if you just have like rubbing alcohol around, smelling that, I find that there's actually some research behind it, but also I personally found that to be really good for just sort of, if you feel that nausea coming, smell the alcohol and you can sort of settle your body down a little bit. Again, eating every 2 hours, and if that's not enough, eating every hour is really, really valuable, because when your stomach's empty, you have more acid, you have more nausea. And that means even eating overnight. If you're waking up to go to the bathroom a couple times a night, snack while you're doing that. That means eating first thing in the morning before you even sit up in bed. So having some crackers or whatever works next to your bed, you're lying down, you take a couple bites, you take those deep breaths that you need to take when you're feeling really nauseous, you sit up slowly, you wait a little bit, then you get out of bed. If you brush your teeth in the morning normally and that starts to trigger your gag reflex, then maybe mouthwash, or just wait until a little bit later. Taking your prenatals or any vitamins that you're taking later on in the day after a meal, maybe at dinner time, that'll also help, because just taking prenatals on an empty stomach is the worst. The nettle tea comes back again. Nettle is fantastic for energy levels. It's not like coffee. It's not going to give you a zing, but it just gives you a little more boost throughout the day. So an infusion, like I described before, an ounce of dried herb to a quart of boiling water, really steeped well. That's a good way to take nettle in. Coffee, if you normally do drink some caffeine, you can absolutely continue with that. Less than 200 milligrams of caffeine a day is safe. And so that's usually, like a regular cup of coffee, like a regular mug is usually, depending on what kind of coffee you're making, somewhere between 100 and 150 milligrams. So that's safe. And a cup of tea is going to be much less than that. So safe to take. For the energy. And then also naps. Again, taking naps, it's kind of the only thing to do. For the nausea, when you start to get into the medication side of things, there's some over-the-counter things that you can take that can really help. And the main one is a combination of vitamin B6 and doxylamine. Doxylamine is also called Unisom. It's a sleep aid, and it's an antihistamine like Benadryl, so it makes you really sleepy. It's very safe during pregnancy. It's one of the only things that I hand out like candy. Very safe, and taking those two things together before bed, for whatever reason, you feel much better the next day, much less nauseous. So 25 milligrams of Unisom, 25 milligrams or more of vitamin B6. And you can also take the B6 multiple times a day. I wouldn't take the Unisom in the morning because it'll knock you out. You'll be even more exhausted. But you can take, if you're taking the two together before bed and you're starting to feel like, okay, this is helping, but I need more, you can take it the vitamin B6 as well in the morning and at midday.
Okay, this is amazing. Thank you so much. Okay, so we have some questions. I mean, you already discussed prenatals, but I guess someone missed the beginning. So if you have something short to say about prenatals.
Food-based.
Perfect. We have a question. You spoke about fish. What are smaller fish?
Oh, don't ask me. I don't eat fish. I
All
don't
right.
actually, but literally in terms of size. And also if you look online or in any pregnancy book, there'll be lists of fish. I think salmon, like tuna is big, I think. So you want to avoid tuna. If I'm
Okay, sounds good. We have a question on dairy intolerance during pregnancy. Do you have any thoughts on that?
If it's a new intolerance, it could have to do with shifting hormone levels. It could have to do with changes in your microbiome. So adding probiotics might help with that, or you might just have to avoid dairy, unfortunately. You'll get to know you, and this isn't scientific, but I think every baby has a personality and will tell your body what they need.
I hear that. I definitely hear that. Okay, there was a question in regards to the eating every 3 hours, and how does that work with weight gain? I think you discussed it a bit, but I think it was brought up again.
Yeah, I don't see that making a big impact on weight gain because you're not eating huge meals each time. Eating uh, essentially the same amount of food, but just more broken up throughout the day. And that's something that later on in pregnancy, in the early pregnancy, eating regularly, like every hour, every 2 hours, is going to really help with nausea. Later in the pregnancy, you'll find that there's no space for your stomach anymore, and you can't eat big meals, and so you have to eat many small meals throughout the pregnancy, and so that it all evens out.
Yeah, that sounds great. Even for myself, I've noticed that it makes a huge difference to not have that dip in the sugar, blood sugar. There was. Oh, I also wanted to share with everybody that we do have another talk on our podcast channels and on our YouTube about gut health, and she discusses probiotics and all of that. So if you want to hear more about probiotics, which Chloe just spoke about, you can check that out on our YouTube channel or any of our podcasting. There was a question about, now we're turning the topic a little bit in regards to when is not getting pregnant a concern?
This is a hard one. I think it's a concern whenever it's a concern for you. It's so the medical answer is if you are younger than age 35, 12 months of trying reasonably timed without success, without pregnancy, is when you start to become concerned and when you would then want to seek out help from a healthcare provider. If you're over the age of 35, it's 6 months. I tried for 3 months and I succeeded after 3 months, but I was on the second month, I didn't become pregnant and I was devastated. I can't imagine trying for 12 months. That's so much energy and time and heartbreak. So if you get to 8 months and you're like, well, I don't know what's going on, that's a reasonable time to check in with a provider just to say, this is what's going on. Do you think I should come in for an appointment? And then that's a time that you can really talk more about it with them. And maybe they'll say, this is all okay. Just keep doing exactly what you're doing. You're doing it right. Or maybe they'll have some recommendations.
Is a midwife the right provider for that? I mean, I'm sure there's other providers as well, but I think some people think midwife, like, okay, birth. Is a midwife the right provider to speak about with this?
I do a lot of this, so for me, yes. Not all midwives do, but if you, um, it's certainly worthwhile to reach if you have a midwife that you've used for prior pregnancies or that a sister or friend has used and loved, reach out to them first because it's easier to scale up in care than to scale down. So once you talk to the midwife, if they say, oh, I think this is a little bit outside of my scope, I think you should talk to some, reproductive endocrinologist, an infertility doctor, then you can go to someone like that later.
Can,
Obstetricians, reproductive endocrinologists, and midwives are the people to go to.
and can you explain that scale? I understood it, but I'm not sure everyone else understood. What does it mean that it's easier to scale up than to scale down?
Just start with the lowest amount of intervention. And I think of this in all of my life, but especially in healthcare. When you are thinking about something that's an issue, you have a scale. This is something that I learned from the herbalists. This I think it's called like the wise woman steps of intervention, but basically it's very straightforward. The first step is, what if we do nothing? Okay, if we do nothing and we keep trying, maybe we'll get pregnant, maybe we won't. What if we bring in some herbs? What if we bring in some medications? What if we bring in surgery? And you keep going up. Someone like a reproductive endocrinologist, an infertility doctor, their knowledge base is in the more intervention side. So you might find yourself going quickly from just trying at home to ending up with getting ready for IVF, which you may end up needing in the end, but it might also be a little bit faster of a jump than you were ready for. If you start with a midwife, you can start with all of the more intuitive things, the diet changes, the herbs, the acupuncture, and have their guidance throughout that. And maybe that's all it takes. But once you talk to a midwife, if they say, you know what, you really should talk to someone about maybe starting medications, then you go from there, maybe to the obstetrician, maybe to the reproductive endocrinologist.
Awesome. Thank you. That was really so clear. In regards to, again, with fertility, what are some practical things that someone can do to help fertility?
All of these things, it really depends. But, I'll just say the most basic and effective thing is acupuncture, I think. Acupuncture is really helpful. It really helps to regulate hormone cycles. There are many different reasons for infertility, and I want to be very clear that a significant portion of those reasons is because of sperm quality. And we don't talk about that very much at all because as women, most of the time, we're the ones feeling the burden of becoming pregnant and making that successful. And also we're very willing to be, to take on the responsibility for that and to say, oh, it must be my fault. But if there are issues in becoming pregnant and you've done all of the basic things and you're starting to think, okay, maybe we need to talk to a care provider, the next step, if you and your husband have a good relationship around these things and feel like you can talk to him about it, both of you going to the appointment is really valuable.
That's beautiful. There was a question about prenatals throughout pregnancy. What are your thoughts? How early is too early? Should someone take it throughout the entire pregnancy? And what about nursing and postpartum?
I mean, if you're open to taking them, yeah, take them the whole time. take them prenatally, or rather pre-pregnancy, because you can really stock your body up with all of those nutrients so that when you do become pregnant, you're ready. Take it definitely through the first trimester if you can stomach it, and throughout the rest of the pregnancy if it will help to reassure you that you're getting all of the nutrients you need. When you're breastfeeding, definitely continue. It doesn't have to be a prenatal, but you can finish out your prenatal bottle if you have one, and then switch to a regular multivitamin. But same as with pregnancy, when you're breastfeeding, unless you are truly starving, baby's going to get everything they need out of your breast milk, and that's going to come from your body. I have postpartum clients, not all the time, but enough to know that it's an issue, who chip their teeth because their babies are taking so much of the calcium from their bones. So
Wow.
take your vitamins.
Wow. Okay. And then there is no too early. Like, it's not like.
No. Except for spending the money on the vitamins, expensive. There's no too early.
Okay. And then we have someone asking about, she says, I'm in early pregnancy and feeling very, very sick. All the blood work came out fine. Any suggestions of anything else I can do or what it could be or something? I mean, you spoke about this already, but anything else?
I hate saying this to people because it makes it sound like I think it's okay that they feel sick, and it's not. But try to take that feeling sick as a reassurance that your pregnancy is healthy. It means you're still pregnant, which is good. There is some thought that the early pregnancy nausea that we have is a protective mechanism, so that you are only going to eat foods that are very safe for your baby. So you're not going to end up eating something that could inadvertently harm the baby. I don't know if that's true. I don't think anybody knows for sure, but I like that as an idea. I like the idea that your body's protecting you and protecting your baby intuitively. But it also is horrible. And I mean, I've never felt worse than when I was really nauseous. Even if you're not vomiting and you're just nauseous all day long, that can be really, really hard. All the things I mentioned before, the eating regularly, taking the doxylamine and the vitamin B6, sour foods, lemons. Someone actually mentioned smelling lemon essential oil. Excellent. Also, smelling peppermint is really good. If you find yourself like hugging the toilet, puking into it, putting flush the toilet and put a little essential oil into the toilet bowl, can help in those really intense moments. And then if you are not able to keep anything down for 24 hours, that's time to check in with a healthcare provider, maybe get an IV, and maybe get stronger medications.
This was incredible. Wow. Thank you so much. One last question. It's about, for many of us, we are kind of going from pregnancy to breastfeeding to another pregnancy. What are your suggestions in between those times? I mean, unless it's the same as what we've said. I mean, obviously that's been said, but just from going from nursing into pregnancy and that transition.
In terms of keeping yourself healthy?
Yeah.
It's the same things. I mean, it's really focusing, again, it's back to my kind of goofy garden analogy, but if you plant the same crops in the same field over and over again, it draws the nutrients out of the soil. And so that's why farmers rotate crops through their different fields. And while you can't necessarily rotate, I don't even know how I follow that one through, but what you can do is give yourself the nutrients that you need to replenish in between. Some people say that you don't fully replenish your nutrients for 7 years after birth, which is a long time. And most people are not waiting that long to become pregnant again. So give yourself everything that you need. A lot of, actually, a really good nourishing food is bone broth. If you like that, any good chicken broth, deep, full meals, and take rest if you can with the kids. Take as much rest as you can take for yourself.
Yeah, I was going to ask you about sleep. What are your sleep's a biggie, right?
Yeah, sleep.
Sleep.
I'm gonna wave my magic wand for everyone here, that you will, from here on out, sleep 8 hours a night, fully from beginning to end.
Amen. Thank you so much. Okay, and we have a tradition here at Living Chassidus where we take a Zoom selfie with our speaker. So if you're up for a Zoom selfie with us, okay. So she says yes. Yay. So our friend Bracha is gonna let us know if whoever feels comfortable would like to turn on your camera, you totally can. And we'll all smile.
Okay, everybody smile. And got it.
Thank you. And Chloe, thank you so, so much. I will be following up with you of anything else that you'd like to, share with us, lists or whatnot. And if anybody would like to reach out, I will also share what your website is.
Cosmosmidwifery.com.
Cosmosmidwifery.com, and you guys can check Chloe out. She also has Instagram. And thank you so, so much. We really appreciate it.
It was my pleasure to be here. Thank you for having me.
Yay, thank you. And good night, everybody. Hope to see everybody again next Wednesday. Be'ezras Hashem.